Tēnā koutou katoa. I'm very privileged to be here. I do feel like I'm amongst the alumni of the sector as I've listened to the other talks and the way that we've been thinking about the world that we inhabit at the moment. I'm going to talk about, and it's interesting actually because as people were talking, I was thinking, oh, I'm just going to cut to my last slide because, you know, it's all been said. But I do have a different perspective to share with you in terms of Stand My Whānau, that we're an old organisation, as Laura was talking about with Mission, and we've had a fortunate situation of having had a very defined mission and a very defined group of young people that we work with. And I'm thinking about when James was saying about, people with 80 contracts and that. We've been very fortunate to have a very focused sort of contracting arrangement with our government funders. But I guess one of the things that I want to just kick off with in terms of, I was reading all the speaker profiles, and that's what got me thinking about being with the alumni, because Grant had to hassle me at the very last minute for a bio, and I was very not forthcoming. So I do want to just give you a little bit of my background, because I'm going to talk about what we've done at Stand, but then I do want to share some of my perspectives about what I'm seeing or feeling about the world of outcomes-based contracting that's coming, and I'll take ownership of those perspectives. And I guess I've been in the social, if you call it the social services sector, I've actually been working in it my whole life, starting in a background of sustainable land management and organics, and working with people with disabilities and going into education. I remember the 91 government coming in and telling poor people that they would need to learn like peasants, and I said, sure, give me the money, I'll teach them how. So we've all had experiences of wondering about, and so I come from a very ecosystem thinking background, and I'm quite fortunate to be with Stand over these last 6 years to navigate a rapidly changing environment, as Chai mentioned. So I'm going to talk a little bit about what we're about. Where's our go on? And I think one of the things for us is trying to share with you in 10 minutes about how we've developed our outcomes framework and what we're doing is trying to make sure that I want to talk a little more about, rather than just jumping to the outcomes framework, about our mission and our theory of change. And I think this is something that we've certainly observed from government's attempt to say we need some outcomes, classic example being the key results areas that government put out with the better public services, bang, stake in the ground, reduced assaults on children. When you do that without a context of a mission and a theory of change, it can be actually create some rather adverse outcomes that are unintended. So we're here to transform the lives of children and young people who are at significant risk of harm to their well-being. And we want to make sure that we can build the capacity to live in healthy, hopeful relationships with others. And this is a really vital element that will come through as we're talking, because on this depends all of the other necessary outcomes with others. And it really is a village around the child approach. And in fact, we would like to think that we have been a children's team for the last 15 years since we introduced our social work framework. And then we, under the, and I'll just, Stand was one of the, I don't know what they called us various things, the Big 10, the something or other, when the improving service for outcomes came to light, and the big funded organisations got boarded to be the band one providers that were going to be off the blocks with outcome stuff. And we did a huge amount of work with MSD around identifying, we've been on this journey over the last 3 years, clarifying and specifying who we are, where we work with, and all the rest of it. And this client target group is the result of some of that work, even though we've been very clear about the children we work with. We work with the 5 to 12-year-olds. It's significant risk of harm to their well-being as a consequence of their environment and their own complex needs. They already demonstrate levels of harm and a range of symptoms of traumatisation due to the exposure of multiple risk and maltreatment. So we're kind of seen as a secondary level service. We believe they have the right to protection, these children that we work with, and they need therapeutic support to ensure their recovery. Getting the wording for this with our partners, MSD went back and forward over many months and making sure we could understand each other's language. So I'm actually eternally grateful to the Productivity Commission's report and the work they've done, because now we can just call them Group D. And I can already see, in terms of my ex-public servant colleagues and people, that some of those people are going to grab that with glee and want to talk about Group D. So I'm really hoping that's going to make our conversations a lot quicker, and then we can get back to doing our work. So we work with Group D. Importantly, though, is having identified that and being clear about who we work with, is what are the principles and the theory that we believe is around what's going to bring change and transformational change for us. Our first one is that harm caused by relationships is best healed by relationships. So in terms of working with traumatised children, we need to start looking at the theories of trauma theory and trauma-informed care if we take this principle and apply it. That a child's home, family, school, teachers, neighbourhood, friends play a critical role in the child's world, and each system needs attention. So it is all dependent on all the others around this child. And that transformative environments that provide therapeutic relationships and authentic experience of belonging, mastery, independence and generosity are quicker and more effective for a child's journey of recovery. So taking those principles, we need to actually say, how are we going to turn that into our service model? And there was a comment made by Chai about the disconnect between people picking outcomes and then their service design. But if we actually come from a place of theory of change and who are we working with and drive it from that way, we can actually go to our service model. So this is our intervention logic. And so we are working to decrease the risk factors. So we are preventing the recurrence of the harm that has taken place, and we are healing the impairment. So we've got absolute clarity about that. And why we particularly take this approach and work with the 5 to 12-year-old is because using the brain sciences and neuro understandings we have, there's a great opportunity to rewire the brains at this age, and we can be quite effective. We have to identify our components, therefore, that will input and start helping us do our service divine around engagement, motivation, the support for change, holistic assessment. What does that look like? Sitting behind those is a whole drill down of ideas that support us in that. We're really clear about our short-term outcomes, results. In the second one there, our childhood outcomes, and then we've got our population outcomes. And our population outcomes, and in terms of, so we have been applying the modelling under results-based accountability in our modelling. And so here we have the population-based outcomes that are going to be a contribution of the whole sector. So these are the outcomes that the sector we're in and the partners we're having, we hope are lining up with this. And we did a workshop with about 7 other providers over a year ago to make sure that as organisations we have our focus, but we also develop some common outcomes that we all knew we shared and that we might be able to start sharing information around. So we're really focused on those short-term results, and I guess in terms of a purchasing idea, then that's what we're going to government saying, do you want to buy this? This is the group we work with, this is what we're here to do, this is our mission, do you want to fund this? So it's really quite clear. Now, we've been doing this for some time. In fact, Standard's about 90 years old. So successive governments will come and go, but each conversation is, this is where we're at, this is the things we do, and we're able to fund some of that mission ourselves. We're not completely dependent on government funding, so that's our mission. Sitting behind that, then we've got an opportunity to say, what are the theories that we will do? So this is our theory based on the tools that we draw on to make sure we can deliver to those outcomes, to go to those outcomes. We call on many things, brain sciences, attachment theory, resiliency theory, RAPA's the responsibility pathways, Circle of Courage, which is the generosity, mastery, belonging model that we brought from Native American Indian culture. and adapted. And I think that's really important to be clear, because that's the practice, and Laura was talking about the people that are actually going to implement this stuff have to have the skill set, first and foremost, to know what they're intervening and how they're going to get to this outcome. Another comment I'd just add to that in terms of the thinking about our workforce is that by having done this and getting this absolute clarity, we've now changed our client management system. And this model drives our practice model in the client management system. And one of the really good things that we're seeing there is that we're able to put all of our outcome areas into the model, into the child and family plan, so our social workers and our therapeutic workers can get on with doing the intervention work and the strategies and the therapies, rather than worrying about whether they can write a good goal or not, because they don't teach them that at social work school, from what we can see coming out of there. So they can focus on the actual work and bringing about the change in partnership with our families. Of course, we've got to decide if anyone's better off after all of this. We have a theory of change. We have a lot of international research we've used to draw and bring this in. And we've got a range of these. These are not exhaustive, and they're not all kind of set in concrete. Actually, there's a couple of new ones in there that we also participated in the outcome trials work with MSD, and we did try some new outcome measures. I'll talk a little bit about that further down the line. But if we take that one and read the improved family functioning, that's quite a broad outcome. So how are we going to know how much movement we're seeing on that and how much improved family functioning we've got? And so then we map our tools. So we'll use a range of tools, and what we've tried to ensure is that we get a balance of well-researched clinical tools and people-focused tools, CDOI. And then we'll gather all of that data. SDQ, Strengths and Difficulties Questionnaire, I'm going to whip through these a little bit, and AAPI2 are our primary ones, and that's about sticking with something and working on it and seeing if you get the validity. These are all well researched and validated. Just back in the red there down the bottom, there's a couple of those are two new ones we're about to do, so it's an evolving situation. Benefits, well, I think for us, it's really sharpened our focus. We've always known what we're doing. We're very focused. We've got a very clear mandate and a very clear mission, but it really has sharpened our focus and kept the child at everything we do, at the centre of it. Provides clarity of service design. So as I was saying, it now informs everything we've built in our client management system as a practice tool, and it's all connected back to the mission and theory of change. Our tool now provides real-time feedback to practitioners so that they can see movement happening as they're working. Laura talked about you can see the change after one session, two session. We want that feedback loop right on the ground for our people so that they're actually reflecting on their practice constantly and seeing how they can do better. And it strengthens our service development and innovation, because we're getting a deeper understanding of what's working and what's not working. Some of these tools may not work. We've put some out, we've brought some in. It supports ownership and accountability throughout the organisation. Probably running out of time, so just a couple of thoughts on outcome-based contracts. We were in the trial, and the learning from that was that it's a complex process. And I would agree. We've been on a long journey. We've had the luxury of being able to focus on it, and in a holistic way, not over 15 different contracts. That's been very helpful. But it is going to take time. A little bit of work coming out of Stanford around how conventional, a little cautionary tale of, performance metrics can't really done the value of the frontline social work, and so we need to be cognizant of that. It's about how we work with that, how we motivate change. Are those valued by the funders to measure? And I guess that's been touched on. We need more investment in capability and capacity for evaluating complexity. Totally agree with that. That was mentioned earlier on. A little bit concerned around if we get into this thing of highly defined working, with the Group D only and specified outcomes, specified time, could we drive organisations to a survival mode and only doing something when we have a broader mission than what the government priorities are? And of course, within this one, humans are not widgets. They won't just tick the boxes and do all those things. At what point is a family fully functioning? What's the end point? And social services are only of value to those that we deliver it to. Will that be measured and accounted for in the government's context? It may have an adverse effect in driving more competition, because now we have a situation where we need to show our unique point of difference. Why should we buy is yours outcome evidence based? How do we do that? And again, because we are humans, then a miracle happens. And we don't, in the humane services, we're constantly evolving and growing and having to test our theories and having to deal with new social situations. But I have hopes and dreams, even though I'm out of time.